Good afternoon and welcome everyone to our Does Trust Have a Seat at Your Table? Why Healthcare Organizations Need a Formal Trust Strategy and How to Build One webinar. My name is Ronan and I will be your moderator for today's discussion. We're excited to be here today and we're so glad that all of you could make it. Now, before we dive into today's session and talk all things trust and healthcare, let's take a minute to meet today's speakers. Here's Vijay and Ahsan.
Great. Thank you so much, Ronan. And good afternoon, everyone. Thanks for joining us today. We're really excited to have this conversation because trust is something I think often gets bucketed into kind of a communications realm. But I think in healthcare, trust is much larger than that. Trust is really the conditions that allow the strategies and tactics that you're putting together kind of work. And I think we all know that we've had the right program, the right innovation, the right kind of communications campaign, but we've not necessarily always seen the results of that. And a lot of that, I think, has to do with trust and whether people feel like they can trust the source, the system, the experience. And I think when it comes to trust really is the thing that allows people to believe in the system and also change kind of their behavior. And I think for a lot of people, trust is kind of intangible. It's hard to kind of wrap your arms around. And it's something that we kind of assume is either there or it's not there. And I think what we're trying to talk about today is how to actually measure trust and the different ways that you can measure trust, the different ways that trust can be built within the system. And that if we're building an organization, we always are thinking about financial performance and service metrics and operational metrics and engagement metrics and things like that. But if we're not measuring trust in a meaningful way, we may only notice that it's eroded or gone away if once it's too late. And I think that's why trust needs to kind of remain visible and top of mind and really just have a seat at the table. The reason that we called this kind of about having trust as a seat at the table is because it cannot be an afterthought. It needs to be really baked into the way that we think about how we're building a strategy, how we're going about building the organization, whatever product it is, service, offering, etc. But it's not just a feeling, it's a precondition for action. And so if trust is not there or if it's not visible enough to manage, we could be making a lot of assumptions about things that may not be true. And so when we're going through this presentation today, I hope that you can kind of think about how often is trust coming up in kind of your leadership conversations when there's not an active issue or crisis, and how much are we talking about trust as kind of a core part of the work that we do. And I think people are arriving into the system, bracing for it not to work. We know that there's a lot of issues within the system, and I think people are not entering the system with kind of a blank slate. And what that means is a long wait time for something is not just a long wait time. It's a hit at that level of trust that the system will be there for them. A confusing referral may not be just an administrative issue. It may feel like I'm not being listened to within the system. And so, when we think we may have like kind of an awareness issue, when people actually have like a confidence issue. And so it's really important to kind of think about where our organizations might be assuming that people understand, believe, or trust more than they actually do. And I think for a lot of people that work within the healthcare system, we have a different view and understanding of how the healthcare system works, how to navigate it, than the lay, a lay Canadian. And so really kind of thinking about how do we, what are kind of moments within kind of our own organizations where people may be silently thinking, okay, here we go again. This is like, we're going to be doing something and it's not really going to hit the mark. And how can your thinking around trust really change that? And so with that kind of strategic frame, I'm going to hand it off to my colleague Ahsan to kind of ground us in what Canadians are actually telling us about trust, and then we'll come back and talk about what the implications of that data is.
Thank you, Vijay. I'm excited to present kind of our understanding and measurement of the data that we've collected that's helped us kind of put this webinar and put this data forward. But to start off with, one of the key stats that we wanted to share was that 60% of Canadians believe that Canada's healthcare system is deteriorating or in crisis. So what that means is that people, as Vijay was saying, people are coming into a system with low confidence, low trust. They expect the system to not meet their needs and not meet their needs when they're asking for care. And we can all we've all had our experiences in healthcare in Canada. We've all tried to access it. I don't think any one of us can say that we've had the best experience accessing healthcare in Canada. We also have to recognize that we are probably a little bit of a biased group in here, in that having a little bit of a healthcare understanding helps us navigate the system and the challenges and needs. But there are many Canadians who don't have that level of awareness and knowledge, and we cannot ask people to trust the healthcare system if they don't trust the healthcare system. We can't ask people to trust the healthcare system and not show up for them in the ways that they're asking for us to show up for them. So, you can imagine someone has a need for care. They then move onto not knowing where to go, having to make multiple phone calls. We also know, generally speaking, about 20% of Canadians don't have a family physician, so that exacerbates the issue. And all of these little levers where people are interacting with the healthcare system are, unfortunately, levers where trust gets lost and confidence gets lost in the system as well. And it's not just a perceptual measurement. It actually changes what people do. So if you don't trust the healthcare system, what do? We see from our data that about 23% of Canadians avoid seeking care. They do not, either they wait to seek care or they don't seek care at all. And what that means is, in many cases, medical conditions get worse. And the issues that brings to the healthcare system is far worse when the time comes for them to access support in healthcare. 42% of people found alternative solutions. So they either self-managed, they went to a walk-in clinic, they went to an emergency room. So again, they are burdening themselves or the system in different ways because they don't know how to necessarily navigate the system, and because they've lost trust in someone offering them the support and help when they require it. What that also means is that it leads to an emotional strain. 36% of Canadians say that they've felt either overwhelmed or have experienced significant stress or anxiety because of the process of navigating the system, and or have lost confidence in the healthcare system as well. So it's not just a physical outcome that is affected when trust is lost. It's also a mental outcome, and we can talk about what that does to a person's. We all know the interrelation of mental health care and physical health care. So when people lose that trust, it's affecting more than just their physical health. And it also, creates financial strain. So what we see is that 31% of Canadians, because they couldn't access healthcare, paid out of pocket for treatment or services. Some of them avoided care altogether due to cost. And that one's interesting because, when we look at that data through the lens of household income, we see the difference in the number of Canadians that avoided treatment due to cost. People making over $100,000, only 8% of them avoided treatment or care. 13% of Canadians making under 100,000 avoided treatment. So we see that it's not also fair. There is socio-demographic impacts that trust leads to, and we see that it's not going to be fair for everyone. The lack of trust in the healthcare system is going to affect different people in different ways. Very often, the system believes and says that we need funding, and funding can solve most of our problems. However, when we ask Canadians what they believe is the problem, 63% of them believe that the problems in healthcare are due to inefficient management, and only 37% of them believe the problems are due to inadequate funding. So part of it is, yes, we can fund the system as much as we want, but if there is inefficient management, then that funding is not having the impact that we want it to have. The other part of that equation also is, if we tell Canadians that the system is being funded and we're not telling them where that funding is going, how that funding is improving management, they are not going to see the results of that funding. So it's simply not, the solution is simply not funding. It's more than that, and how we communicate to Canadians where that funding is going and how that funding is being used to improve how they are able to access healthcare. And a lot of that comes in their mind from inefficient management. We do know, obviously, in Canada, we have provincial healthcare systems. So I'm sure, a lot of you are thinking what the provincial data looks like on this. And I can tell you that it's consistently high in terms of the number of Canadians that are saying that they believe that the system is deteriorating or in crisis. So it's not just a province. There are provinces where the issue is significantly worse, but generally speaking, this applies to all Canadians, and we see that all Canadians are experiencing the system in a low trust environment. And to that point of socio-demographic differences, we also see that trust is not experienced equally for racialized versus non-racialized Canadians, which again means that different communities are navigating the trust environment differently. So when we look at the data, we see that 23% of racialized Canadians use the walk-in clinic, versus 13% of white Canadians. 11% of Canadians racialized Canadians gave up on seeking care versus 6%. So what that means is that many of those racialized communities are looking for alternative solutions and alternative trust levers. We see they are more likely to trust AI. They are more likely to trust social media, online communities, and health influencers and creators. So because they're losing, they have lower trust than other Canadians, they are looking for alternative sources. And generally speaking, white Canadians aren't as trusting of the same sources, but it's also because they have other trust levers that they can rely on. Generally speaking, when we do talk about trust, we have to understand that this is an environment, or Canadians are accessing healthcare in an environment with a lot of information. We are constantly bombarded with information from social media, the news, everywhere. But even in this environment, the people that, or the highest trust sources remain healthcare professionals. So, 83% of Canadians trust doctors, 87% of Canadians trust pharmacists, and similar for nurses. When we look at trust in governments, that sort of declines a little bit. 60 to 70% trust government health websites, public health agencies, and medical health websites. So there are where the information and services and products are coming from is an important thing to consider, because there are varying levels of trust in different sources. And some of the other low trust sources that we see, but we also see that these are increasing over time. Only about 27% trust AI tools for health information, 21% online communities, 17% social media. But we do see a trend towards these additional sources being more trusted than in the past, because there are more people using them. There is a younger generation that relies on them, is accessing them. So we do expect a lot of this to increase with time. And we see that when we look at the AI tool, trust in AI tools by age, we see some of those differences, and I'll walk through that shortly as well. So as I said, trust in AI is emerging, but we generally see broad public trust has not caught up yet. As I said, 27% have a lot or some trust in AI tools for health information, but you can see how that differs by age. When we look at sort of 18 years to 44 years, 30 to 40% of them trust AI, but then it kind of 55 plus and 65 plus, those age groups are not as trusting of AI when it comes to accessing health information. So by again understanding who your audiences are and what you're trying to achieve, if your main target is 55 plus and you're used in AI and they're getting information through AI, they're not as likely to trust that as some of the younger generations. So again, it is very important to understand who your audience is, what they trust, what trust means for them, where you can build that trust, and really understand that as one of the levers to building trust for your communities. And I'll hand it over to Vijay to kind of end this off now.
Thanks, Ahsan. And so I think if we step back from the numbers that Ahsan just kind of showed us, the story is not simply that people are frustrated or that people, have these different experiences, but that trust is being shaped kind of across a bunch of different dimensions within the healthcare experience. And that matters because trust problems or different trust problems require kind of different organizational responses. And so the question now for leaders isn't just like, are people losing trust in the system? It's where is the system, where is trust being lost, and with whom, and for and why? And so when we look at this, we see from the data that trust is being shaped by availability. It's whether care feels connected, it feels affordable, feels credible, it feels fair, it feels human. And I think each of those are kind of a different trust lever, and the connection of whether the system feels coordinated or fragmented, affordability, all of these different levers of trust really need to be understood at like a more granular level to understand which type of trust problem you have within your organization. So it's impossible to close a gap effectively if you haven't really understood where that gap kind of comes from and what's driving that gap. And so I think it's important to remember that even with some of the smaller numbers that we saw in the report, trust is not just one big thing. It's a lot of small signals that are adding up over time. And if we're misdiagnosing the trust problem, we can prescribe the wrong solution for it. But I think also within healthcare organizations, there's often some assumptions being made and things that are being discussed because of like anecdotal evidence. And I think it's really important to kind of make sure that we're looking at this holistically and thinking about the whole journey of an individual as they kind of move through the system to understand where is your organization best set up to kind of help build back some of that trust. And I think that's why I think trust is an important part of communications, but it cannot be only living within communications. I think it's like clear messaging obviously matters, reputation matters, transparency matters, but we can't put all of the weight on communications. And I think we need to be thinking about design from a trust perspective and really designing for trustworthiness within the system. And that means kind of aligning with what people are told with what they uh, aligning with what people are told with what they're actually experiencing within the system. And I think one of the risks around kind of making some internal assumptions or thinking that because you've heard from a few patients or a few of your stakeholders, which obviously is important perspective, but really thinking about, are we making the right assumptions, and how do we kind of gut check those assumptions in a meaningful way, and in a way that also you can kind of track over time. And so, when we think about how we work with clients, and we're trying to help people understand where's trust breaking down, which audiences are kind of most affected, because to Essen's point earlier, not everyone is experiencing the healthcare system in the same way. What expectations are people bringing into the experience? I think which are the moments that create kind of confidence, and which are the moments that kind of create doubt, and what proof do people actually need before they believe change is real? I think we've lived in a moment where there's been a lot of like funding announcements and governments promising this and that, but if people don't actually feel that, it's hard for them to feel that sense of trust in the system overall. And I think the best strategies around trust really begin with like some humility in understanding that we don't necessarily know where confidence is breaking down, and where is it that we can actually have kind of the greatest impact. And so when we think about a trust strategy framework, we're thinking about kind of five main steps. The first being kind of diagnosing the gap. So where's trust being lost? What moments are creating that friction, doubt, or disengagement? The second step is really a segment challenge. So where is this issue most prevalent or most acute? Because we know that trust isn't kind of experienced equally, and different groups, have different expectations. They also face different barriers, and also require different proof points. We also know that we also kind of help to define those trust drivers. So what do people actually need to see, hear, or experience in order to drive that kind of higher level of trust? And this is where we actually kind of can identify the levers of building that confidence or trust. And then step 4 being kind of that prioritizing trust building actions. So what needs to change, what's most feasible, what's also sustainable. One of the things that we often hear from people is that like initiatives may start, but then the funding is lost. And so those initiatives can kind of fall off. And while they were doing a lot of great work while they existed, if they're not sustainable, then that creates a different problem, because people have now learned to expect something and then it kind of goes away. That creates a different sense of a lack of trust. And then step 5, where I kind of want to focus a bit of time right now, is measuring trust as kind of a strategic outcome. And I go back to like, you have KPIs for like all these other areas of your business and organization, but if we're not measuring trust in a meaningful and intentional way, we're not going to know whether it's improving. We're not going to be able to say whether people feel more confident in the system. We're not going to be able to say why people are engaging or not engaging. And so I really want to kind of focus a bit of time here, because I think trust cannot be just like measured once and then kind of put on a shelf. And that's why I say it needs to be coming into the conversation. Every conversation that you have needs to be thinking about, okay, how are we building trust through this initiative or through this program? Because trust is also fluid, and it does move, and it does change over time depending on what the experience is. And so the goal isn't necessarily just to kind of collect more data, but to make better decisions around these strategic imperatives, kind of around trust specifically, and really thinking about how you can use data and research to move from kind of, we think that we know this, to we know enough to act. And so, when I kind of when I'm talking to clients and we're talking about these types of issues, before investing into like a trust building initiative, what is it that you need to kind of know first in order to make something that's meaningful and not build something based on just a few conversations that you may have had in the past. And so I think also when we think about trust, because trust can become this very vague or hard thing to kind of put your arms around, it it's really important to have that kind of cross-functional discussion as well, in terms of like, where are the levers of trust that we can most kind of impact. Um, so if we go to values, and for any of you who follow any of the stuff that I write on LinkedIn, you know that I talk a lot about values. And the reason that I talk about values is because I find it's the best way to really humanize the experience of an individual is through an understanding of their values. And it allows me to build empathy for someone who looks and thinks and acts differently than me. And I think we use Patient Connect, which is our kind of segmentation, to really understand how values impact someone's interaction and the way that they engage with the healthcare system. And the reason that we use it is because we understand that underlying values really impact the way that people go about managing their health and thinking about their health more generally. And so when we think about change and introducing new programs, initiatives, that kind of thing, we having an understanding of someone through that lens of values allows us to think about segmenting audiences in a way that moves away from like demographics, like they have this condition, or they are over 65, or they're female, and really get into more of a nuanced conversation about how do we actually build trust with this specific type of mindset or kind of underlying uh, value set that is motivating their behavior. And so when we think about, there's no, when it comes to trust, there's no average trust problem. Trust is, it's a very nuanced conversation, and we need to ensure that we're checking ourselves against this idea that one initiative will be able to kind of rebuild trust amongst a huge broad swath of the population. Not all people need the same reassurances. And by using kind of segmentation, we can help kind of move people from kind of a louder message to a more smart, a smarter way of building trust, which is through this more kind of segmented way of communicating. And I think with a lot of the technologies and a lot of the ways that people are gathering information, like Ahsan said, there's no one source of information, but there are multiple places that people are going to get information. And so thinking about what is the messaging, what is the way that we want to connect with people, how do we connect with people in a way that actually like builds that sense of trust and confidence. And I think when we look at averages and don't think about things through a kind of a segmented lens, that can really actually hide a lot of the trust gaps that you really need to understand. Because oftentimes what we see in the data is that trust for different issues is more experienced or less experienced by different segments. And so thinking about who your audience is, and where are they most likely to kind of hold back, and really kind of questioning, do we understand why that's happening, can be really helpful in ensuring that the ways that you're approaching this kind of trust building exercise is is meaningful and actually kind of makes a difference, but also is something that you can track and think about kind of over time. And so I think that when we think about the applications of applying this framework across healthcare, we work across kind of a lot of different, or we work with a lot of different types of organizations. So we have the benefit of kind of this 360 view of how trust is built and the ways that it needs to be thought of. So from a government and policymaker perspective, it's really, can people see that reforms are creating visible change and change that they can feel? When we think about health system and providers, it's, do pathways feel clearer, coordinated, and less and easier to kind of navigate? When it comes to pharma and life sciences, it's really, do people see the education and support as credible, useful, and non-promotional? When we think about digital health and AI organizations, it's really, do people understand how the tools are going to work, when to use them, why they're safe to be used, that kind of thing. And patient organizations, it's like, do people feel represented and practically supported? And I think that it's really important to think about trust in all of these different dimensions, even if you're not working within, you may be working within one type of organization, but to be thinking about all the ways that trust is built along a patient pathway is really important to understand where you can actually insert yourself to kind of make a difference. And I think that when we think about kind of what makes strategy possible, kind of with health, and one thing that I'm hoping that people can kind of take away from this is that trust is not the outcome of strategy; it's really what makes the strategy possible. And so, thinking about it after you've built your strategy is not a way of building trust. It really needs to be present from the beginning and part of the design process, in terms of when you're thinking about what your strategy is, what your tactics are, what your strategic imperatives are, thinking about where does trust fit into that, and where resistance may kind of occur, and what are the ways that you can kind of to help kind of resolve some of that. And so I think trust is something that should be monitored over time, but it should be monitored in more of a nuanced way. One question around trust: do you trust us, or do you feel confident? That's not going to give you really enough in order to understand where you can make a meaningful change. And so I think trust needs to be asked in a bunch of different ways, and not because we need multiple measures of trust, but because trust is dynamic. It's multidimensional in terms of the way that it's built and the way that it's lost. And so, it's shaped by the way that people kind of experience the system, what they hear, what they see happening, and whether promises that are made kind of turn into this proof. And so, if we're not measuring it in a dynamic way, in a multidimensional way, we could be losing an opportunity to really build back some of that trust that's been lost in the system. And I think when organizations that are managing trust, or thinking about managing trust, will be the best ones, will be the ones where they can see that confidence is rising, where it's falling, and really, again, be able to answer that question of why. And that doesn't mean turning trust into this kind of cold metric either. I think sometimes, like, when we put metrics against something like trust, that is very much related to kind of how people feel. It's really about ensuring that we're measuring trust in a meaningful way that allows us to pay attention to it in a more intentional way, as well. Because I think trust is something that I think for a long time the healthcare system is taken for granted, because we have this sense of universal healthcare system, et cetera. But that is obviously falling. That 60% number is something that I quote often, because it really is putting in bright lights for us a true problem that exists within the system. And I think that when we think about our strategy, not thinking about trust at that time, or like as we're going into our planning and all of that kind of thing, we really lose an opportunity to make a meaningful change in people's lives and make your organization more effective in the way that you're kind of going about and doing the work that you do. And so, kind of as we close and before we move into questions, it's really like, I want to leave you kind of with some questions around, like, where's trust really kind of helping your strategy right now, and where may it, quote, quietly be holding you back? And what could change in your organization if trust wasn't something that you just kind of hoped for or expected, but something that you actively monitored and managed and put resources and intention kind of behind? So with that, I want to thank everyone for joining us today. I know that trust can be kind of this abstract topic, but I think that there are ways of making it more concrete and more part of the way that you think about your organization and the strategy that you kind of put behind it. So with that, I will open the floor for questions.